My name is Amanda Gorsney, and I will be doing my presentation over prescription drug prices in America, but you'll see that I'll focus on one disease in particular. So the overview and problem, Americans spend more on prescription drugs than any other country in the world, so an estimated average of $1,200 per year. And one of the most widely prescription-associated diseases in the U.S. is diabetes, with approximately 34 million people affected, which costs the U.S. more than $327 billion per year. As most of you know, diabetes occurs when the body is either unable to produce insulin on its own or when the body resists effects of insulin or doesn't produce enough to maintain normal glucose levels, so that is type 1 and type 2. Between 2002 and 2013, insulin prices nearly tripled. The image on the next page comes from Consumer Reports, showcasing the household changes across the nation due to increased general drug costs. These high costs are preventing many people from continuing to fill prescriptions or consume expired prescriptions, causing more illnesses like kidney failure or blindness, or in some cases, death. According to the American Diabetes Association, the reasons for this increase are not entirely clear, but are due in part to the complexity of drug pricing in general and of insulin pricing in particular. In order to find solutions on the insulin affordability issue, there needs to be a better understanding on the insulin supply chain. So here's just the Consumer Reports graphic. With the Obama versus Trump administrations, there are a few differences. The Affordable Care Act, known as Obamacare, was signed into law in March 2010. The act had the goal of improving healthcare coverage, access, and quality for all Americans, but Obama stated that one of his main goals within the act was to provide better care, prevention, and treatment for anyone suffering from diabetes, according to his presidential proclamation in October 2016, which also declared November as National Diabetes Month. The ACA authorized the creation of the National Diabetes Prevention Program at the Centers for Disease Control and Prevention. The program is designed to help prevent or delay type 2 diabetes by participating in lifestyle change programs. And then with Trump, there's a quote from a statement on National Diabetes Month in 2017 that says, "My administration is committed to empowering more Americans with the tools and research needed to combat all forms of diabetes. We give our support to the medical professionals and caregivers who have dedicated themselves to battling this disease and the scientists and researchers who are on the cusp of great innovation to ease the daily burden of care." And then he also stated that he supports an initiative to lower prescription drug prices. In December of 2019, the House passed legislation allowing the federal government and pharmaceutical manufacturers to negotiate drug prices. Additionally, Trump has voiced that he will help make lower prices happen by opening up drug imports from Canada. There are still several steps to take, such as manufacturer agreements. However, in February of this year, Trump released his budget proposal for fiscal year 2021, which, while he recommended extending the special diabetes program, his proposed budget would cut more than $190 million to the National Institute of Diabetes and Digestive and Kidney Diseases, which is the nation's premier research agency toward treatments and a cure for diabetes, as well as a cut of $7.3 million to the National Diabetes Prevention Program. Here's a brief history over insulin in general. In 1923, insulin became commercially available in the US. Before 1983, all insulin was derived from animal sources, and then in 1996, the first rapid-acting human insulin analog called Lispro was approved. And then in 2013, an ultra long-lasting insulin, it lasts for 48 hours, became available in Europe, but then was declined in the US. And then also, jumping back over, in 1997, the CDC, the National Institutes of Health, and 200 other organizations launched the National Diabetes Education Program. And then the history policy. In 1973, the Diabetes Mellitus Interagency Coordinating Committee was established. It was led by the National Institute of Diabetes and Digestive and Kidney Diseases and representatives from federal agencies It was established to coordinate federal efforts to prevent and control diabetes. And then the Medicare Prescription Drug Improvement and Modernization Act of 2003 expanded diabetic services covered by Medicare to include diabetes screenings for beneficiaries at risk for the disease. So basically, Medicare covers diabetes self-management training for those who meet eligibility requirements, and may also cover things like supplies and care. And then again, the Affordable Care Act was signed into law in 2010 with the main goal to provide better care, prevention, and treatment for diabetes. And then also, like I mentioned before, there may be potential for upcoming budget cuts in the fiscal year 2021 budget, targeting things like diabetes. And there's a few congressional jurisdictions that happened recently. The Promoting Access to Diabetic Shoes Act was introduced in March 2017. The bill allows a nurse practitioner or physician assistant to fulfill documentation requirements for coverage under Medicare of special shoes for diabetic individuals. Under current law, such requirements may be satisfied only by a physician, and this came directly from GovInfo. And then the Insulin Price Reduction Act aims to do exactly that, reduce insulin prices. Insulin is a matter of life and death for those affected by diabetes, and the act calls on the 3 U.S. insulin manufacturers to reduce the list price of insulin products back to the 2006 list prices. So the price would reduce to approximately $68 per vial, which would overall reduce the price of most insulin products by 75%, and the act was introduced in October and remains under jurisdiction still. For public opinion, I just read in a few places, diabetes is reaching the public eye and catching the attention of people in power more often lately, and the backbreaking insulin prices are too much to bear for millions of Americans, and the public also requests price transparency throughout the insulin supply chain. My stakeholder analysis goes along the lines of people either supporting or opposing the increase in prescription medications. Consumers will obviously oppose because they don't want to have to spend more money on their necessary life-saving medication. And then Democrats and Republicans are pretty much on the same line. Lowering insulin prices had also been a major focal point of several of the 2020 presidential candidates on the Democratic side. And then I found an article from one state in particular, which was Minnesota, that is hoping to work toward a free insulin plan under a proposal given by the Senate Republicans. Their proposal would cost the pharmaceutical industry millions, so then I put them as neutral because of this, because they also don't necessarily want high medical costs for diabetics, but they would profit from the high prices. And then manufacturers would support it because they want to keep out competitors and receive exponential profits as well. Then my quadratic chart just displays exactly what I had discussed in the previous slide, so I'll just let everyone look over it for a minute. The American Diabetes Association has already presented 4 policy alternatives in relation to insulin prices: streamlining the biosimilar process, increasing pricing transparency throughout the insulin supply chain, lowering or removing patient cost sharing for insulin, and increasing access to healthcare coverage. So basically, the ADA hopes that the Food and Drug Administration will encourage competition in biosimilar alternatives to insulin, and they want to know exactly how money passes through the supply chain and how manufacturers, wholesalers, pharmacy benefit managers, health plans, and pharmacies profit throughout the supply chain. And the ADA recommends that the health plans and government programs limit out-of-pocket spending for medications. And then finally, they also recommend that all health plans and government health care programs be prohibited from moving medications to higher priced formulas. My cost-benefit analysis shows again that in general, Americans spend $1,200 per year on prescription drugs, but those affected by diabetes have an average annual cost of $5,705 per year, which then costs the U.S. over $327 billion. And then clearly there are benefits of insulin, since it is a life-saving drug that allows the body to use sugar from carbohydrates, which is energy, or store that glucose for future use. Insulin helps keep blood sugar levels from getting too high or low and keeps people from going into shock or having severe health effects. So clearly there is benefits to it. Lastly, my recommendations go along with the congressional jurisdiction to implement the Insulin Reduction Act, since the act would lower insulin prices to $68 per vial, which is much more affordable to more Americans. And then in many diabetics' lifetimes, the insulin prices have jumped dramatically, at least tripling in price. I think there should be some sort of freeze on prices once the Reduction Act gets passed, since this will help thousands of people get back on track with their drugs, and we cannot let the prices of this life-saving drug to rise so drastically again. And then here are my references.